Hello, everyone, and welcome back to RN Info, the place where you get clear, reliable information on health topics. Today, we're talking about angiotensin receptor blockers, or ARBs for short. Before we dive in, here's a question to think about. What is the primary mechanism by which ARBs lower blood pressure? If you don't know the answer just yet, stay tuned until the end of the video to find out. Alright, let's get into it. So, what are ARBs? ARBs are a group of medications commonly prescribed for cardiovascular conditions such as hypertension and heart failure. They can also be used in the management of chronic kidney disease. Now, to really understand ARBs, we need to look at how they actually work to reduce blood pressure and decrease the overall workload on the heart. ARBs work by blocking angiotensin 2. If you watched our last video on ACE inhibitors, you'll remember that angiotensin 2 is a potent vasoconstrictor, meaning it squeezes the blood vessels and raises blood pressure. It also causes the body to retain salt and water, which further increases blood pressure. What ARBs do is block the receptors that angiotensin 2 would normally bind to. By blocking those receptors, ARBs produce the opposite effect. The blood vessels relax and the body stops retaining excess fluid. Now that we understand how ARBs work, how do we recognize them? ARBs usually end in the suffix "-setan". Some examples include irbesartan, candesartan, and losartan. Moving on to the side effects. Like most blood pressure medications, ARBs can cause low blood pressure, which may lead to dizziness. They can also reduce blood flow to the kidneys, and they can cause hyperkalemia, which simply means elevated potassium levels in the blood. High potassium can be dangerous for the heart, so this is something to watch closely. Now, if you remember from the ACE inhibitors video, a persistent dry cough is one of the notable side effects of ACE inhibitors. ARBs are actually a great alternative for patients who experience that cough because ARBs do not typically cause it. You still get the same blood pressure lowering benefit, just without the cough. When it comes to contraindications and interactions, ARBs are contraindicated in pregnancy due to the risk of fatal harm. You also want to use caution when combining them with other antihypertensive medications, since this can cause blood pressure to drop too low. Additionally, be cautious with anything that raises potassium levels, such as potassium-sparing diuretics or potassium supplements, since hyperkalemia is already a potential side effect of ARBs. For monitoring, this ties directly into those side effects. You'll want to monitor vital signs, particularly blood pressure, to ensure it isn't dropping too low. You'll also want to monitor lab values, specifically potassium levels, and keep an eye on renal function. Alright, let's go back to those questions. First, what is the primary mechanism of action by which angiotensin receptor blockers lower blood pressure? I'll give you some time to think about this. The answer is, they occupy the receptors where angiotensin 2 normally attaches. Second question, which suffix is commonly used to identify ARBs? The answer is "-setan". Third one, ARBs are often prescribed as an alternative to ACE inhibitors because they do not typically cause which side effect? We talked about this one, so you should know. The answer is a persistent dry cough. Fourth question, a patient on an ARB should be monitored for which electrolyte imbalance? The answer is hyperkalemia. And final question, what physiological change occurs when ARBs block the binding of angiotensin 2. The blood vessels relax and blood pressure drops is the answer. Okay, that brings us to the end of the video. Let me know in the comments how many you got right. I'd love to hear from you. If you found this helpful, please like and subscribe, and I'll see you in the next one.